All right, so can tinnitus cause vertigo? I'm going to get into the details of this question, and hopefully by the end of the video, you're going to be asking something different. Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, and I not only want to help you figure out what's causing your vertigo, but I also want to help you recover from it. The best way to get my help is if you hit that subscribe button and the little notification bell next to it to get notifications on when I come out with new helpful videos. And to help you out more. So let's talk about this question of, can tinnitus cause vertigo? Now, tinnitus is the perception of sound without an external stimulus, kind of like vertigo is the sensation of movement without any kind of external stimulus. Now, if you're usually it's a ringing or a buzzing or a kind of whooshing sound or roaring sound. Now, if you're hearing something and there's no external stimulus, don't worry, you're not crazy. There's usually some kind of explanation as far as anatomical structures or something happening in the brain that's causing that problem. Maybe you are a little crazy, but it may not have anything to do with the tinnitus. But don't worry, I think all of us are a little bit crazy. I mean, even me, hence why I keep talking about the crazy. So I think I got a little sidetracked. Anyway, so let's get back to tinnitus and vertigo. Now, the question of, does tinnitus cause vertigo? Tinnitus is a symptom, vertigo is a symptom. Neither are a cause. So does tinnitus cause vertigo? I would say no. But the question you need to be asking is, okay, what is causing the tinnitus? And is that in relation to the vertigo that you're experiencing? So what are some reasons that you could be having this tinnitus or this ringing in your ear or the perception of sound in your ear? Now, one thing could be from noise-induced hearing loss, so some kind of loud noises that you're really exposed to, whether it's over a chronic period of time or a long period of time, or one instant that caused damage to the hearing system, which is the cochlea in the inner ear. Another reason could be just as you age, some of some of that deteriorates as far as how well it functions. Or, sometimes even just earwax can be causing some ringing in the ear. Medications can damage the inner ear system as well, particularly, like gentamicin is known to cause problems with the vestibular system in particular. Infections in the inner ear can damage the cochlea, the hearing organ, and cause that ringing in the ear. You also want to, TMJ disorders can cause ringing in the ear, sometimes neck injuries, brain injuries, multiple sclerosis, stroke or cerebrovascular accidents. So those kind of brain injuries, MS and CVAs or strokes, that's more of a central problem. So something happening in the brain that's causing this perception of sound rather than a injury to the inner ear system that would be causing a perception of sound. So the next question would be, all right, so did the tinnitus or the ringing in the ear come on when the vertigo started? So we want to figure out, are the two related? So in this case, you want to start by looking at some diagnoses that can affect the cochlea and the vestibular system. So the vestibular system helps with your equilibrium and balance. The cochlea is that little snail-like structure that helps with your hearing. Now, some problems that might affect both would be a labyrinthitis, so infection in the inner ear that causes inflammation to the cochlea and the vestibular system. Another problem is a vestibular schwannoma, so this would be like a tumor on the vestibular nerve, or what they call acoustic neuroma, a tumor on the cochlear nerve, and they're right next to each other. That could be pushing on either one and causing that tinnitus. Autosclerosis, which is the abnormal bone growth in the small bones in the middle ear. And you can also have like a perilymphatic fistula. So that's like a little hole between the middle ear and the inner ear that's causing that can cause tinnitus as well as vertigo, or a semicircular canal dehiscence. It's kind of a thinning of the bone or a hole that's in a different area that can cause tinnitus as well. So you can have structural problems with the inner ear, but you can also have problems with how the brain is processing information. So that can come from, as I said, stroke or MRS, Meniere's disease, or vestibular migraines can affect how the brain, Meniere's disease would be more of an inner ear problem. Migraines would be more of how the brain is processing information, possibly causing tinnitus. And then there's also, for the inner ear system, like an autoimmune inner ear disease is a little more rare. You're probably getting tinnitus in both ears. So that's an important thing to note as well. Is it just one ear? So is it the structures in the inner ear that are affected, or is it both ears? You're probably looking at either an autoimmune problem that would affect both ears, or more of a central problem like vestibular migraines, stroke, MS, brain injuries. Maybe a few. There's some other diagnoses that would usually just affect one ear that possibly could affect both, but in the most part, you can kind of differentiate it that way. So there's a whole list of things that could be causing tinnitus and vertigo. Now the other thing that I would want to say is that tinnitus doesn't necessarily cause vertigo. We want to be looking at, are they occurring together? And they are both symptoms, so one won't cause the other. So we have to figure out what's causing each of them, and are they even related? So sometimes they may not be really related at all. Maybe you have tinnitus from hearing loss, but then now you're experiencing vertigo from vestibular neuritis, or vertigo from BPPV, or vertigo from vestibular migraines. But just because you have both doesn't mean that they're related. In some conditions, they can be related. Now, that kind of muddies up the water, but you kind of have to take all of your symptoms into account when you're trying to figure out what's triggering your symptoms. So the answer is no. Tinnitus doesn't cause vertigo. They're both symptoms. You got to figure out what's the underlying cause of either both of them or each of them individually. So I hope this video was helpful for you. Thank you for watching, and hit that subscribe button if it was. All right.